You mentioned that your wife has had a few different ultrasounds, and at some point they told her that she has a placenta previa. They've put her on bed rest, and they've encouraged that she not do much, and also suggested that your baby is born by C-section at 37 weeks. And it would be best to follow your doctor's advice and to deliver by C-section at this point in the pregnancy. Even if she doesn't have any bleeding episodes between now and then, it's good to still do it because the whole purpose of delivering early is to prevent something from happening. A placenta previa is where the placenta, or the organ that's feeding your baby, has attached over the cervix. And the cervix is the opening to the birth canal. And there's all types of things wrong with this scenario. First of all, the placenta is your baby's lifeline. It's full of blood all the time because the mother's heart is pumping blood to that location. It filters through the placenta to the umbilical cord, which of course is the connection between the placenta and the baby so that the baby is fed through the placenta and umbilical cord. This is how they receive all the oxygen and nutrients that they need. If anything happens to the placenta or the umbilical cord, it affects the baby's oxygenation status. In the case of a placenta previa, if you have this large blood source right over the cervix and a woman starts to contract or dilate at all, then she starts to massively bleed. So it's so good your wife hasn't had any bleeding episodes. And again, this is what your doctor's trying to prevent from happening. Now, the recommendation to deliver at 37 weeks is heavily weighed out. Babies born at 37 weeks are considered full term, meaning that in most cases their lungs are mature and they do well, especially long term. Long term, your baby will be fine. In the meantime, there could be a few hurdles to overcome when babies are born a few weeks early, but overall things should be good. And the risk to your baby being born at 37 weeks is way lower than letting your wife's pregnancy continue on if she were to start to have some sort of bleeding episode. That could affect her well-being and the baby's well-being. So your doctor's weighing out the risk versus the benefits of delivering a little bit early, and the benefits are way higher than the risks. The other problem and the reason for the C-section is that you can't deliver the baby's lifeline first, and you can't let the mother bleed too much because this would affect her well-being and the baby's well-being. So your doctor is giving you good, sound advice, and I hope that the pregnancy continues to go well for her and that it's uneventful until your baby is born. Congratulations ahead of time on the delivery of your baby. And if you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.